Auriculotherapy has come a long way in the last 30 plus years in this country. Beginning in 1971, we started doing some work at 3-4 of our hospitals here in the Tulsa area. We began having study groups in some parts of Oklahoma, Texas, and around the country. And about 1973 and 4, I started spending some time on the West Coast for 3 and some up to almost 5 years. Terry Olson at UCLA did a lot of work, and I met him back in 1975. One of the books that he published is this, the second edition. We have some of the earlier work from UCLA School of Medicine back. It was published back in about 1970, in the mid-70s. 3 or 4 of the books from UCLA came out from 75 to 1980, where Terry Olson and Dick Cronin published some work that was published in the American Pain Society back in 1980, where 40 patients were draped with a sheet, came up with a 75% accuracy determining pathological problems in the body with that patient draped with a sheet. Back in the very beginning of 1971, one of the devices that we started working with first was the puntoscope. This is the puntoscope that had a potentiometer that you had to adjust sensitivity. And we had a little polarity switch that we had to put it, the little dot you see there's a positive pole, to the left is the negative pole. The patient would hold this was the anode, and pull it back to diagnose and find and treat the point. We're using polarities back then. We had a bipolar electrode, a spring-loaded, that you see right here. Put it against this and you can see. They were both spring-loaded, and we looked at the differential measurement. But we had to adjust the potentiometer right here. We had to adjust the potentiometer, and we got Y's, and we were adjusting it all the way down as low as we could get it to 1 or 2 megohms. But it only delivered the device that looked like this, what was called the TheraPuncture, that would only deliver about 8, not generally more, and most of them not even 8 microamps of current. But this measured with 5 microamps of current. So what we're doing today exceeds the expectations that we got with this puntoscope back in, that was developed in the 60s, and we had some in this country back in 1969. A.E. Sola, that worked with our late Janet Travell, that worked with our late President Kennedy back in, she was his personal physician. But Sola started using the word back in 1973, according to his comments in 1973 in one of the meetings in San Francisco. Today, we look at treating points. We're treating a lot fewer points. Many times just 2 and 3 points does more than what we were getting with a dozen points. If we treat as many as 8 or 10 or 15 points, it's usually 1, 2, or 3 of those that do 80, 90% of our work. And what we're doing, this is one of the charts that we've used with all 3 dermal layers, which is a little complex because it's got so many points on it. But this is the musculoskeletal system just in the upper extremities. Here we have the shoulder, arm, the elbow, and look at where the shoulder is, right straight across from the concha ridge. Look where the elbow is on the inferior crus, here, straight across to the elbow. The wrist center in the triangular fossa straight across for the wrist, the hand and the fingers up in this area of the ear. Now, we started using what Dr. Noget called the phases, phase 1, 2, and 3, back in the late 70s. And he was showing us some work in Montreal. I think his second trip that I was with Dr. Noget was in the late 70s in Montreal. And some of the crude drawings he had where he drew the ear and would show some of the markings of second phase, upper extremity. Lower extremity was in the inferior concha. The spine was cervical here, thoracic, lumbar, sacrum. So now, in 1989, he reversed it where the cervical is here and the cervical is here on the trachea. That's the third phase, cervical, thoracic, lumbar, sacrum, you'll see in another chart. This is the lower extremity, the hip, the upper leg, the knee, the lower leg and the ankle and the foot. The upper extremities, this is the second phase, lower extremity, and third phase, lower extremity. Here we are with the second phase only, both the spine, and this is what I use a lot today. It's a cervical, thoracic, lumbar, sacrum. That's after he flipped the spine. He reversed it in 1989 in the last writing we had from Dr. Noget. This is where we had the cervical, thoracic, lumbar, and the sacrum was against the concha wall. So you'll see another chart where it shows a breakdown to where you see dimension on it.